Hi, I'm Dr. Richard Ellenbogen, coming to you from my new offices in Century City. I'm talking today about rhinoplasty. It's all about getting it right the first time. Not many people who have their nose done realize that about 30% of patients who have their nose done don't like it or have to have it done a second time and even a third time. Part of my practice, about a third of my practice, is revising people who have unsatisfactory nose jobs. It's all about proportion and understanding what the doctor will do. A lot of the words used in rhinoplasty, straight, sculpted, natural, don't really mean anything. For that reason, I put everybody on the computer to show them what they're going to get, to give them a good idea that we're both on the same page. It's not necessary to have packing in a nose job. People have fear of the packing being taken out. In many cases, it's not necessary for the nose to be broken. In fact, approximately 8 out of the 10 rhinoplasties that I do on patients, the patients don't require any pain medicine. The old days of having black and blue and the eyes swollen shut is a thing of the past. The surgery isn't done the same way as it was previously, and the anesthesia is different than it was previously. It's all about matching the different parts of the face. A lot of people will realize if somebody has a small chin, it'll make the nose look larger and will have the chin augmented at the same time. But not a lot of people realize that a flatness in the face here will make the nose also appear too large, and a doctor not being comfortable with that or cognizant of that might make the nose too small, because sometimes we have to enlarge this area with fat grafting in order to match the nose as well as the chin or other parts of the face, so everything matches and looks natural. Just making a nose smaller like it was in the old days is not enough anymore. It has to look natural. It has to be something that somebody could have been born with. Someone who is ethnic, someone who is Armenian, Middle Eastern, it has to look natural, that it fits with their ethnic background. A woman's nose is not a man's nose. A young woman's nose is not an older woman's nose. An older woman's nose has to look elegant. A younger woman's nose also can look elegant, but there's also a cute factor that a lot of young women want. The point is that it's no longer necessary to have pain after the surgery. The surgery can heal very, 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 very quickly. You can have your new nose, in many cases, before summer vacation or other events that you want to have it for. The surgery is all done from inside the nose. There are no scars externally on the nose, and the healing process, basically, you can take a shower the next day, and many people can drive their car by the second day after the surgery. So the downtime is not the same as it was 10 years ago, 15 years ago. And some of the things you read on the internet that people say about their rhinoplasties simply are not true in this day by expert practitioners.